going to introduce Mr. Fred Castellano. He's the Director of Managed Care Contracting at MD Anderson, so he's going to talk about the financial insurance side of navigating cancer.
Yes, I'm the non-physician up here, so I had that old Sesame Street song back in my head. One of these things don't belong with the other, as I was sitting up here on stage. But hopefully, in the few minutes I have here, be able to give you a little bit of background on how cancer is changing from the standpoint of the financing piece of it. All right. So I want to talk a little bit about the industry in itself. Briefly talk about public exchanges, high deductible insurance products. I'm sure everybody's familiar with those, how those impact patients and insurance members. What do we think is going to happen next? And I promise you I don't have any real big explosive secrets there, but just kind of give you a feel for how the landscape may be continuing to change. And then finally, some financial support services and programs that are out there, or what to ask for, and so on and so forth. So if we look at the industry as a whole, if I could sum it in one word, it would probably be change. So if we look at the reimbursement piece or the finance piece of healthcare, it's a jumbled mess right now. And you know, we're seeing still healthcare costs continue to rise, as shows in that top graph there. And it's really, for the most part, is we just got a more aging population. And so as those costs continue to go up, it causes two things to happen. It's causing the payers or the insurance companies to look at establishing reimbursement policies and practices that are going to be able to reduce their costs and manage their own internal quality measures. And it takes the provider side and it helps them kind of introspectively look at their operations and their financials to see how they can better operate as well in the changing environments. So what you're seeing happen is, and you guys are very familiar with this, is you're seeing those costs that the payers, the insurance companies are trying to control, are being passed along to the patients or their members. And mostly, in most instances, in high deductible health plans. You can see in the bottom graph here, that light blue line there on top represents deductibles. And you could see the bottom two, there's another blue line there on the bottom there. That's the increase in people's wages. So you can see that huge disparity between how wages are growing and how high deductible plans and those high deductibles are growing. So it's obviously a concern from a financial perspective. So we had the marketplace and the Affordable Care Act, and if you guys have turned on the news or read a newspaper, you know that right now there's a big state of flux with the marketplace and the Affordable Care Act. And so I want to just touch for a couple seconds on the public exchanges and really where they started in 2014 and where they are now is they're almost non-existent. And if you look at the majority of the national payers, the Aetnas, the Cignas, the Humanas, and the Uniteds, they've almost pulled completely out of the marketplace in the exchange products. And you may see a few here and there scattered throughout the United States in some counties, but for the most part, it's non-existent, which again, it makes it difficult for folks from the standpoint of trying to get insurance that's affordable. So I mentioned high deductible insurance products or high deductible health plans. And so they're not really new. They've been around for over 10 years. I remember before I came here, I worked for a large payer, and I remember when I first started there, I was all excited. I said, I'm working for a payer. I'm going to get like practically free health insurance. It's going to be great. And I found out that that wasn't the case, that I was just going to get a high deductible health plan, just like everybody else, which is fair, but it becomes challenging. And so let's just start with a quick definition. So a high deductible health plan from the IRS's perspective is $1,300 deductible, for an individual plan, up to $2,600 for a family. Now the reality of it is those are actually probably very good high deductible plans, because I know my high deductible plan when I was back in the insurance industry was for family was somewhere in the $6,000 range for a high deductible plan. So these are relatively lower from the standpoint of cost. But you can see, tying back to my first slide, you've just got rising healthcare costs, insurance deductibles that are outpacing the average person's income. In fact, if you look at the Bureau of Labor Statistics, 2015, the average worker salary was about $41,000. So you tack on a $3,000, $4,000, $5,000 family deductible, and you're taking a big chunk out of that family's salary. So you've definitely got some issues from that perspective. You've got salaries just in the last year between 2014 and 15. Salaries have increased around 2%, but you're seeing a 9% increase in medical costs. So again, we haven't right balanced that equation. And so from the standpoint of the deductibles and why would you say, well, why would anybody really want to have a high deductible health plan, or who would be interested in that besides the insurance companies? Well, it's actually beneficial for employer groups. So if you're getting your coverage through your employer, it obviously lowers their costs if they can pass that cost onto their employee. So kind of still talking through that why scenario, why high deductible plans. Again, from the employer perspective, it's a cost, right? It's just more cost to the member, like I said earlier. And 25% of workers that get their insurance through an employer group health plan have a high deductible plan. And so if we take that timeline we talked about just before, which was only a year, and we stretch it out between 2006 and 2015, you can see that the average deductible in these high deductible plans for members rose 255%. And again, tying it back to wages, within that same time period, it's only really increased 32%. So again, your wages are not obviously increasing near as much what the cost is for healthcare. And then the second bullet, where many employees never really reached their deductibles. I mean, that tended to be my case. I had family coverage. My wife used to get aggravated with me every year and say, you work for an insurance company, and it feels like we don't have insurance. All we do is we pay, because we just never hit our deductibles, which I guess is a good thing in essence, because there was no significant costs. But most folks don't. So they're truly spending that deductible money that they could be using for other things. And then if you look at from the individual plans, 90% of the folks that are on the marketplace in the ACA have a high deductible of $1,300 for an individual plan or $2,600 for a family plan. So again, like we said, there's a shift to the cost of the member or to the patient. There's also a shift to the cost of the provider. So from the provider's perspective, there's more self-pay balances, so there's less of a cost maybe to collect some of those balances. So there's a cost to the provider as well. Now there is mounting evidence that high deductible health plans are successful in a more positive way in reducing costs and care use. We'll talk about that in a second. So one thing is, if we look at box number one, is the drive to price sensitivity. So, consumers typically, if we go out and we go buy a car or we go out and buy a TV, we don't typically go out and just buy a particular car and a TV. We price shop and we look around and we see which one is the best deal. Well, that wasn't the way healthcare was. Historically, you just showed up to the doctor, or you just went to the hospital. But nowadays, you're seeing people become more that consumer as they would be for normal, what I'll call just normal goods. So you are seeing some positives, and we'll talk about the question mark foregoing care on the next slide, but you are seeing some spending reductions, and you're seeing 25% reductions in physician office spending, and you're seeing an 18% reduction in ED spending. And again, that's a good thing. I mean, I remember before the high deductible health plan days when we had our first child, if he had a runny nose, we were off to the doctor. We were paying our $25 deductible. It was cheap. It was $25. Didn't have to worry about it. Office visit, and we were there. Should we have done that? Probably not. And as you had the second child, you realize you don't have to run to the doctor every time. So there is some benefit, I guess, in that it's driving down maybe some of those unnecessary visits or some of that unnecessary cost. But you are finding, it's a strain on families, it's a strain on patients, and you find that you've got 25, 30% on average of families that are having trouble paying for their health care or paying for their other bills because they don't have the liquid assets, they don't have the cash to do so. And then thirdly, it's also causing folks to shop more carefully. So we talked about becoming more of the quote-unquote normal consumer. Instead of using those same philosophies and buying a TV or a car, you're actually looking for the better price, and obviously you should be looking for quality as well. And you can see that 75% roughly of consumers that have a high deductible health plan, the higher ones, the $3,000 or higher, are out there and they're price shopping. So again, kind of this first bullet point here kind of expands on my comment previously. Is you've got 50% of the families out there with high deductible health plans that have a family member that's got some chronic condition that truly have a problem paying bills because of health care. I used to work in patient business services years ago and was responsible for billing and follow-up on claims, patients' claims in the hospital. And if you think about it, the cost is so extreme that when people have to rank what they're going to pay this month from their salaries or their monthly bills, healthcare tends to get pushed further and further down just because of its cost. So we mentioned foregoing healthcare in the previous slide. So on the short run, we are seeing some of that, right? And we'll look at the last two. You've got 43% of the people skipped a recommended physician test or treatment. Okay, that's not a good thing, obviously. 41% didn't fill a prescription. So again, not a positive aspect of high deductible health plans. So there's definitely concern. It's not all rosy like the insurance companies want you to think it is and beneficial as there's actually true issues for the patient from the standpoint of getting the necessary treatment needed. So what's next? So we know the Accountable Care Act is changing. I wish I could tell you how it was going to change, because then I could retire and get on the speaking circuit, because I could figure out the one question that everybody else can is how do you fix health care? So again, we're seeing drastic reduction in the payers in the marketplace, arguments across party lines and what the right fix is. And so I don't know that we're going to have a true, good, clear picture in the next few months. Do I think there's going to be some solution? Absolutely. And if I had a bet, I think it's going to be some bipartisan solution. I think we're finally going to get the Republicans and the Democrats, both parties, working together and actually coming out with some form of health care that hopefully includes some of the more important aspects of the ACA that's currently in place, so that we don't go back into the days where everybody was in a risk pool and there was, if God forbid you had a pre-existing condition, you couldn't get coverage. So I think we're going to see, at least hopefully, that pre-existing condition kind of follow through in the next plan and so forth, and hopefully get us back on track and get things set up. So what do we think are not changing? So I can tell you that high deductible health plans are here to stay. In fact, you'll probably see those deductibles increasing depending on how quickly we can manage total healthcare costs. Everything now from the insurance perspective is really trying to control that cost. So I would expect high deductible health plans will continue to be around and continue to grow. Many of you are probably seeing your choices and from an insurance perspective expand, right? I remember when I got my first job, it was, okay, here's your insurance, Fred. There's no choice. It's just this is what you had. Now you look and hospitals or healthcare companies are setting up tiered benefit plans where you have, you can choose between this plan or this plan. And if you choose the second plan, you can't go to these providers. And the third plan, you can't go to these providers. So it's getting more and more choice-driven and more complicated. So I think you're going to continue to see that. And unfortunately, it's going to really continue to see more financial responsibility by you folks, the patients. I think what you're seeing now is that the patient is the new payer from the standpoint of healthcare. Gone are the days where it's just the insurance companies. Now, as patients, you're becoming your own payer, so to speak. So what can you do to try to help with some of that financial burden? So, some of the things I'd recommend from the standpoint of whether you're here or any other provider is seek out financial counseling services to see if you qualify. Now, again, not everybody's going to qualify for Medicaid or an indigent program, but you might be able to get something from the marketplace, and work with your social workers, your discharge planners to do that. If you qualify, ask about patient assistance programs as well, pharmacy assistance programs. Ask for a self-pay discount. If you have a service and you can pay it up front, ask for a discount. You're more than likely going to get that. I think ours is 10%. I mean, you can get a 10% discount. It's not a whole lot, but it's something. So if you have the means to pay, ask for that discount. If the bill is a little too high and you can't afford to do it in one shot, ask for payment plan options. That way you can at least spread that payment over a period of time. And then obviously there's local county government options as well. We can contact government agencies, county agencies, the Cancer Financial Assistance Coalition, and Cancer Care's Helping Hand both have searchable databases that you can use to go out and look for financial assistance, either nationally or regionally. So those are options. I did a Google search and come up with the 211 Collaborative, obviously the American Cancer Society, the Administration on Aging, United Way is another alternative to look for assistance. Prescription drug assistance is also available, and there's a varied amount of organizations that are out there that potentially can assist as well. And that's it. So I'm going to open it up, I guess, as we sit down for the panel questions.